Hello, everyone. I'm Rukmini Banerjee, President of HasNa, and I'm delighted to welcome you today to the official launch event of our new report titled Understanding Gender-Based Violence Response in the Humanitarian Context in Turkey. You can find the report along with our speaker bios and more information on this event on our webpage at hasna.org. Forcibly displaced women, girls, and other marginalized groups have faced violence, discrimination based on their legal status, national origin, ethnic or religious identity, gender identity, sexual orientation, and so on. The coronavirus pandemic and the subsequent economic downturn has seen a global rise in cases of gender-based violence, yet not much evidence exists on how gender-based violence impacts forcibly displaced communities with fewer options to access legal, economic, and social aid. Turkey, as a host to the largest population of refugees worldwide, has a special responsibility in ensuring the protection of those displaced individuals who have faced or are at risk of facing gender-based violence. HasNa's report seeks to shed light on GBV response from the perspective of service providers, examining how local CSOs, national and international NGOs, and municipal actors work to prevent GBV and protect survivors from within Turkey's refugee community. With that in mind, it is an honor and privilege for me to introduce our distinguished panelists today, each representing a different aspect of frontline response to gender-based violence in Turkey. We have with us today Eski Durmaz, migration specialist from the Istanbul Metropolitan Municipality's Migration Unit, Dilara Turker, protection supervisor at the Research Center for Asylum and Migration, or İGAM, and Fatma Hacıoğlu Sarada, Regional Program Manager at the Humanitarian Program of the United Nations Population Fund, or UNFPA. Thank you all for joining us today. Before we jump in, just a few quick notes on the format. We have 2 rounds of questioning followed by Q&A from the audience. If you're joining us via Zoom, please submit your questions through the Q&A feature on Zoom. We are also broadcasting this event live on YouTube. So for our YouTube watchers, please feel free to submit your questions through the chat box. We'll keep an eye on all the questions coming in through all the platforms. And finally, please don't forget to visit our website, hasna.org, to view and also to download the latest report. So without any further delay, I'm going to jump into the first round of questioning. My first question is for Eski. Eski, we were acquainted with the Istanbul Municipality's Migration and Social Cohesion Action Plan, and I wanted to ask you a little bit about the greatest priorities of the Migration and Social Cohesion Action Plan and what specifically is being done to protect migrant women and children in the region.
Hello, everyone. Thank you for inviting us. It's a pleasure to be a panelist in this discussion. Migration Unit of the Istanbul Metropolitan Municipality was established in 2019. Then, as you said, we developed an action plan on migration and social cohesion for the next 4 years. And so far, we completed the first year of the plan. And under 4 main objectives, we have 4 strategic objectives, and they were set together with a wide range of stakeholders. And the 4 objectives are coordination, capacity building, data collection, and social cohesion and coexistence. These are the 4 strategic objectives that the Istanbul Metropolitan Municipality set for itself in migration governance in Istanbul. And by coordination, we mean coordination between the district municipalities and other actors, and capacity building of the IMM staff and district municipality staff, capacity building of the municipal services, so that they can be more inclusive for the migrants in the city, and data collection, because we need more analytical data in the field with the age and gender breakdowns and as per the districts, so that we can produce more evidence-based policies in migration, and we can provide services on specific needs. And finally, social cohesion and coexistence is actually one of our main focus. because it's really important in a metro in Istanbul as a big metropolitan city with more than 1 million refugees. In terms of protection of migrant and refugee women and children, our main goal is increasing the inclusiveness of IMM's services and all municipal services in Istanbul. We don't specifically target migrants or refugees. We don't produce specific like differentiated services, but we mainstream the inclusiveness among all services of the IMM. And maybe I can talk about them later in detail, but for now I can summarize as IMM has a Directorate of Women and Family Services, and under this directorate we provide the shelter and the Women Solidarity House and the Women Solidarity Hotline. So what we do as migration unit as a starting point was ensuring that these services are including migrant women and children in the city. So we ensured the multilingual service provision and specialized staffing in these centers. And I think for now I can summarize like this, then we can go on details. I hope I kept my time.
Yes, no problem at all. Thank you so much for that. And since you brought up the question of inclusiveness and inclusivity, my next question is for Fatma. We wanted to talk a little bit about, marginalized groups, especially in the humanitarian context. So what has collaboration with grassroots NGOs looked like for you, especially for an international organization when it comes to protection of LGBTI migrant communities? And can you tell us a little bit about the initiatives at the community or grassroots level?
Thank you, Rukmini, for the question and actually inviting us to be part of this panel. I have a few visuals that I would like to show, if that's okay.
Certainly.
Maybe I can start with introducing UNFPA in a couple of sentences for those who are not familiar with our work. UNFPA, United Nations Population Fund, is the United Nations Sexual and Reproductive Health Agency, and we are working closely with government, local NGOs, UN agencies, and other partners to ensure that sexual reproductive health and rights and responses to gender-based violence are integrated into emergency responses. Strengthening the access to services for vulnerable groups, especially in the areas of protection and health, is one of our important areas of work. We work within the principle of leaving no one behind, and in this context, we carried out humanitarian aid activities aiming to reduce protection and health risks of various groups, such as women and girls, youth, refugees living in rural areas, key refugee groups, and other refugees with special needs. I wanted to talk about more who are the key refugee groups and their vulnerabilities, but should I do it first or maybe later? How do you prefer?
Whatever is convenient for you. We really don't have a preference. You can start with that if you wish to.
Okay, because in order to give perspective about our grassroots initiative, I want to tell a bit more about who are key refugee groups and why are we working with them, for them. So this is a visual that we use to showcase the interconnectedness of vulnerabilities of the key refugee groups. Refugees come to Turkey, as you all know, as you also mentioned, that in the beginning, from either from Syria and other countries due to civil war, economic and humanitarian crisis situations, or other reasons. And humanitarian crisis and migration itself increases vulnerabilities of all individuals. People affected by conflict and crisis, they experience disruptions to their personal, social, and economic lives. including family separation, loss of income and assets, cultural upheaval, and the collapse of traditional social structures and livelihood opportunities. And we all know that access to basic needs and livelihood can remain interrupted for extended periods. And as people lose their livelihood, security, and protection, it is also known that various protection risks increase, such as sexual violence, sexual transmitted infections. And when we factor gender identity and sexual orientation into this situation, the risks may increase. And key refugee groups that we mentioned includes LGBTI refugees, sex worker refugees, and refugees who live with HIV. They experience various forms of stigmatization, discrimination, gender-based violence, and other human rights violations. We observed that there is a huge unmet need on information and services such as legal counseling, case management, and psychosocial services. Many key refugee groups, including LGBTI refugees, report being exposed to gender-based violence constantly, including physical, sexual, psychological, and economical violence. And we observed that different forms of violence are not mutually exclusive. So at times, they reinforce each other, and most individuals are exposed to multiple forms of violence. So especially in the cases of verbal violence or violence perpetrated against trans and or sex worker refugees, there are significant difficulties in reporting or documenting such violence cases. Also, there's a lack of information among the key refugee groups on their legal rights, ways to access justice mechanisms, especially after gender-based violence, and in relation to their legal status in Turkey as refugees. In addition, waiting periods for resettlement to third countries might take years, and this results in further psychological issues among key refugee groups, including increased suicidal tendencies. And while these are the needs, there are individual social, cultural, and structural barriers for KRGs access to these services. And while accessing these services, we know there's a lack of information and awareness on the needs of these key refugee groups I mentioned. And this results in absence of adequate protection programs. Specialized services responding to the needs of key refugee groups are usually rare, limited, or non-existent. All these factors increases the vulnerabilities of the key refugee groups and force them to live in a vicious cycle. So this can also result in negative coping mechanisms such as substance abuse, unprotected sex, or inter-community violence, etc. So with the interventions supported by UNFPA, we work with community-based organizations to break this vicious cycle for key refugee groups while working with them. So since 2018, we have started this program called Key Refugee Groups with 2 national NGOs, Positive Living Association and Red Umbrella Sexual Health and Human Rights Association. And the project is financially supported by European Union humanitarian aid. Should I go into details or should I do it in the next round, Rukmini? I know I had 5 minutes.
We can circle back maybe in the next round.
Sure.
Once I go to Dilara and then come back for our second round of questions. But thank you. Thank you for sharing the slides and the presentation. So my next question is for you. I guess, Dilara, how has COVID affected GBV programming, and what has been the greatest challenge in responding to the needs of migrant women and children?
First of all, thank you for your questions, and it is a pleasure to be in here. And my answers is IGAM, the Research Center on Asylum and Migration, was established in 2013, and the field office of IGAM in Ankara was established 3 years ago. In the field office, as IGAM, we are providing counseling, one-to-one counseling, accompaniment, and the translation support. Especially to the survivors of beneficiaries, we highly interested in accompaniment and the translation support during the whole process of taking the protection order and the complaint mechanism to the police stations and the finding shelters. But when the COVID-19 cases are highly increased last year, we turned our working mechanism to remote working, unfortunately, and in that time we only provided telecounseling. And during this period, accompaniment and the translation support, face-to-face translation support were decreased. And this was very challenging for us. Also, according to statements of beneficiaries and the need assessments results indicated that staying in houses for a long time due to pandemic and the restrictions and the curfews increased sexual and gender-based violence in the houses. And these results of the increased requests for the psychosocial support and the legal counseling. And in this period, we observed that beneficiaries did not feel comfortable during telecounseling, especially when they have to talk about the gender-based violence for themselves. And the telecounseling, I think, was very challenging during that period on this issue. And also, I can say that technical insufficiencies, for example, not accessing the individual smartphones or the tablets was very challenging. But we try to provide informative sessions and the informative videos on the social media pages and the YouTube channel of IGAM. We try to provide information on rights and the social services to the beneficiaries. I think it is from my side, it's all, and thank you.
Thanks for sharing that, Dilara. Since we are on the topic of challenges, I just think that it would be appropriate for me to also ask you another follow-up question, with another impending crisis. So with the humanitarian crisis in Afghanistan, should Turkey expect a new influx of asylum seekers, including vulnerable women and children? And in what ways can civil society organizations prepare for this, if so? And what are the differences in serving Afghan versus Syrian displaced people under the Turkish immigration system? I know it's a lot packed into one question, so I'm happy to, ask them to you one by one, but I'm just, since we are on the topic of challenges, I just thought that this would be appropriate to bring up right now.
Yeah, thank you for again another these questions. Yeah, Afghanistan crisis is a big issue recently, and I think there is a huge uncertainty on this topic and on this issue, because the Turkish government is communication with the international organizations, and the UN is in touch with the Iran, and these can be determinative on the mass entrance to the Turkey by the Afghans. And we know that Taliban is controlling borders, and this can be very challenging and can create difficulties, especially for women and the children. And there has been a temporary protection regulation for the Syrians, as we all know, and if mass influx by Afghans became a fact, maybe another temporary protection regulation for Afghans can be established, but this can be very complex, and this creates complexity for Afghans lives in Turkey recently. And also, according to unconfirmed source, if the mass entrance by Afghans to Turkey became a fact, maybe, not certain, but maybe a refugee camp can be established in the east of the Turkey, but details are not known, and the source is not very specific. But this can be happen. We don't know exactly, and Turkey does not share their contingency plans. And as IGAM, we propose them to share to prepare ourselves, and maybe INGOs, NGOs, and the non-governmental organization can prepare themselves to in case of contingency. There is a huge uncertainty, as I said before, but we'll see.
Thank you. We've been reading all about the ongoing crisis in Afghanistan. We know that Turkey is, probably a huge contender as a destination country for more migrants coming in from these regions. So it will be interesting to see how that plays out and what further responsibilities it will add on Turkey's growing, growing role as a destination country for migrants in the region. Fatma, I'd like to come back to you regarding the role of international organizations. You talked a little bit about the contributing factors that lead to gender-based violence, especially among marginalized groups, and also the role of community-based organizations. Can you tell us a little bit more about what specifically are the challenges faced by LGBTI persons, especially within the key refugee groups that you talked about, and how has UNFPA responded to these challenges? And again, how have you collaborated with grassroots communities to respond to the challenges?
Yeah, thank you, Rukmini. In the previous slides that I mentioned this, there are several layers of challenges faced by vulnerable groups, and I mentioned in that visual the mainly key refugee groups. Those are LGBTI refugees, sex workers among refugees, and refugees living with HIV. And those challenges are really interconnected. And when you enter the factors of gender identity, sexual orientation, health status, whether the refugees living with HIV or not, or their occupation, if they are a sex worker or not, or their legal status, if they are registered or not, or staying under temporary protection or an international protection applicant, etc. So it kind of varies. So each individual's case should be kind of taken into consideration separately. So in order to do so, we together with the two national organizations who has been working in Turkey for many years before, together with such marginalized and vulnerable populations, we developed this program, which we call Key Refugee Groups. And within this context of this program, we established, we then established first 5, but then increased it to 7 service units in 6 provinces of Turkey. These are Ankara, Eskişehir, Mersin, Denizli, Yalova, and there are 2 in Istanbul. So within these 7 service units, we try to provide specialized protection services to key refugee groups. Specialized in a sense that in each province we have different refugees with different needs among the key refugee groups. So according to their specialized needs, the key refugee group service units, you would call it a safe space, provide specialized services to reduce their protection risks. And although the service units are located in 6 provinces, the services can access to all around Turkey because we have a refugee support line operational 24/7. And all services, including the refugee support line, provide services in Arabic, Persian, English, and Turkish. As you mentioned, the Afghanistan and the the program project itself, when we look at the numbers, so far provided services to more than refugees coming from more than 97 nationalities. So the program itself does not only provide services to Syrians under temporary protection, but provides services to a wide range of refugees. Services provided physically through the service unit, and also my colleague from IGAM mentioned, since COVID-19, remote services also been provided. We provide services including information on relevant legal frameworks for legal assistance, health issues, gender-based violence, registration, resettlement process, and access to basic services are some of the main topics covered by our service providers. Also, we have legal counselors working at the service unit, inform beneficiaries regarding their basic legal rights and guide them on access to justice mechanisms. Also, one-on-one psychological counseling or group counseling is provided to beneficiaries. Gender-based case management is one of our major services. And many beneficiaries, because we know from the risks that I mentioned earlier, require case management support in connection with various forms of gender-based violence. HIV counseling is very crucial for this group I mentioned on how to access testing, treatment, and care. So currently, Key Refugee Group Service Unit provide HIV information through the materials according to the needs of the diversity and the diversity of the group. And also, due to the language barrier, fear of stigma and discrimination, and other structural barriers the key refugee groups are facing, they have limited access to services, as I also mentioned earlier. Through this program and the service unit, we aim to reduce these barriers for them to access services, existing services. So in order to do that, we provide transportation, temporary accommodation, accompaniment, and also coordinated referrals. And these are some of the services we provide.
Thank you, Fatma. Thanks for sharing that. Eski, my next question is for you. So one of the things we discovered throughout our interviews while we were working on this report was that trust between authorities and frontline responders on the one hand and migrant GBV survivors on the other is critical and often lacking. So in what ways can these authorities and frontline workers establish greater trust with migrant communities and thereby encourage them to report instances of abuse or gender-based violence?
I can reply this question from IMM's perspective, and on behalf of IMM's service, IMM's specialists and employees working in the Women Solidarity House and Women Solidarity Hotline. And first of all, we believe that the capacity building of our own staff working in these services is highly important. So to build a trust and provide a quality services to beneficiaries. So we organize technical trainings in working with people with trauma background, and we seek to develop the capacity of the staff, particularly working with migrants, because migrants and local community, they share common problems, common obstacles, but sometimes it's really different. It requires different specifications to work with them. And one of them is, of course, the language. We really give importance in providing services in their own language, such as Arabic, Farsi, and we provide also French and English translation. And we also place our staff with linguistic skills in those centers. so that people can feel more comfortable and feel and build a trust with the staff. And besides that, we also adopt a holistic approach between social services and from a development perspective, and our regional employment offices, our vocational training centers. So besides providing shelter and first response and protection, we try to support in later stages with our Solidarity House, with other opportunities for people to go out of the crisis with more strength. And besides that, I think at the beginning I mentioned our social cohesion and migration and social cohesion action plan. But I think it's very important to say that we also have a local equality action plan. And our two action plans are talking to each other and following the parallel targets and objectives. This is also very important so that we can mainstream gender equality at every level of service provision and each stages of prevention and protection and response. And in the shelter, we also we give great importance in working with the specialized staff. Our social workers are all accredited to work in this field. They're all equipped with the necessary skills to work with the beneficiaries. And we give great importance to the confidentiality because local municipalities, they build a really close relationship with the citizens in the city and at every level and every aspect of their lives, so that building this relationship with beneficiaries is really important, and it requires a long-term commitment. So we try to keep this approach also in our work with GBV victims or people who are at risk of GBV. And later this year, we also plan to open a women's shelter. And we also work really carefully for staffing this place with specialists, and staffing this place with also specialists who worked with refugees, who has background in working with refugees and migrants. I think this is it.
Thanks, Eski. We're nearing the end of our, moderated questions, and I would encourage our participants to please send in more questions through the Q&A feature. We have a few trickling in, and I can start. Fatima, maybe you can take a stab at this one. So what are some, are there, first of all, are there any initiatives that focus on engaging men and boys in combating gender-based violence in the refugee communities? And if so, can you tell us a little bit of any existing initiatives in Turkey right now?
This is a really good question. Yes, as part of our, we have actually two up and running program. As I mentioned before, within the context of leaving no one behind, we are working with women and girls, and we have established, currently we are running 4 of them. Women and girls safe spaces provide protection and health services. Within the context of women and girls safe spaces, it is also very important to ensure that we work with men and boys, so that women and girls are they able to access the services within the centers. Also, men should take part of responsibility in sexual and reproductive health as well. So they should know, and also they should, men also should be aware of family planning and be part of participate in that as well. In order to ensure that, a couple of years ago, we have started working with men by establishing a group, training the relatives or the close male groups of our female beneficiaries of these women and girls safe spaces. So in parallel, our service providers organize sessions with men, semi-structured sessions with them to talk about masculinity, role in fatherhood. So they start with light issues and then go advanced issues together to challenge, patriarchy and their role in family and so on. This is this has been very useful, and we are trying to replicate this in other provinces of our operations too. The second point is that working with men and boys is very, very important. We all know that while working with key refugee groups, we cover mostly cisgender gay men under the key refugee groups, or trans men. We do specialized case management towards this group under the key refugee groups. However, we also noticed, and we are aware of the conflict resulted sexual violence. And therefore, we know that there are men and boys who are survivors of sexual violence due to either conflict related or on their way to the country. This means Turkey, or within Turkey. In order to support and provide specialized case management to men and boys that are not part of key refugee groups, in 2020, we established 2 specialized service units, one in Adana and in Izmir, focusing on refugee men and boys, and they provide similar services, including case management for sexual violence, psychosocial support, and also legal counseling. Within these service units, we also organize activities with men, refugee men, similar to I mentioned earlier, but this time they talk about more on like patriarchy, masculinity, challenge their masculinities, and also start discussing about violence, how it affects, and how it actually kind of circle back and affects not individually, but on family or social, societal level. So this is one of the things that we are doing, and we observed, we knew that it is very important, but while working together with men and boys, we noticed that it's also another important group to be, working with.
Thank you for that. Our next question is for Dilara. So access to refugee communities seems to be a challenge, especially for vulnerable populations like those suffering from various forms of gender-based violence. So how do you go about creating links and relationships within the communities?
Yeah, thank you for your questions. And this is a good question, I think, because as I mentioned before, telecounseling was very challenging for us. But in the hybrid working modality, we provide both face-to-face counseling and the telecounseling. During the 2 years, I think we established a community committee volunteers who are 10 Syrian, Iraqi, and the Afghan refugees. They are known by the refugee population in the field, and the refugee population build the trust for them. And as we all know, house visitations are not allowed by the Minister of Family for the INGOs and the NGOs, except from the Turkish Red Crescent. Therefore, we cannot make house visitations, and we cannot observe the exact situation. Therefore, the community committee volunteers make outreach and the house visitations for IGAM and for us. They collect essential information and they make referrals to field office. And the detailed assessment is made by the protection team, and the interventions are made by them. Also, we try to become more active in the social media pages, because we experience that refugees can access us to via the social media pages. They cannot come to our office due to some reasons, the technical issues maybe, and the transportation issues maybe, but the social media pages and the internet was very effective way. These are the things I can say from my side, and thank you for questions again.
Thank you. There's one for Eski here. So for the Istanbul Metropolitan Municipality, what policies should be developed and supported to combat gender-based violence in general, and especially within refugee communities?
Okay, it might be also respond to your question about trust building. But I believe that, what we try to do in IMM is we should benefit from the expertise developed among the NGOs and civil society working on the ground first. Because in Turkey, there are many civil society initiatives and organizations that are working and very well in the field, and that are focusing on combating GBV. Besides that, the municipality, first, the development of the action plan, local equality action plan, I think it's a good step. And we will focus on implementing the targets in the action plan in the upcoming 4 years. And besides that, to work with refugees in terms of combating against GBV, migration unit, we closely work with the Directorate of Women and Family Services. And under the services, there are over 20 family counseling centers in Istanbul, counseling and training centers. And we try to improve the services, try the inclusiveness of the services for the refugees and migrants. We provide multilingual services there, and trainings for the families, refugee and migrant families, and improve our outreach to these communities. And besides that, in general, to combat with GBV, we believe that women from refugee and migrant communities should join more into the social life in the city, social and economic life in the city. So we believe we need to adopt a holistic approach and consider all aspects to encourage women and facilitate their involvement in every aspect of life in the city, which includes supporting their inclusion of labor market, formal labor market, and their inclusion of cultural and artistic sphere, public sphere, and they encourage them to learn the language and provide Turkish language courses, provide more vocational training courses, and not just provide, but facilitate their inclusion. So.
Thanks for that. We have a couple more trickling in. The first one is for Fatma. What can be done to combat the stigma faced by key refugee groups?
A lot of things should be done. So, of course, I'm sure I will be missing out many. There are, maybe I can start with the things that we have been doing. We observed that one of the limitations is that key refugees groups limited access to existing services that could be either public services or services provided by other humanitarian actors, could be NGOs, INGOs, and UN organizations, for instance. And this would be due to the behavior of the service provider within that institution, and that we notice that behavior is itself is not kind of an intentionally bad. Is most of the time the service provider would not know either correct terminology, how to approach the beneficiary, which words to use or how to approach, or where to refer, or don't know basics about some issues like HIV or etc. So we started from there. We developed trainings, awareness raising sessions targeting these institutions. Before that, we organized meetings, inviting people from different perspectives, not only the protection officers or social service experts, but people from health sector, people from livelihood, people from municipalities, from different backgrounds. They came together and they discussed, because we realized that coordination is still an issue, because all the people, service providers working in the humanitarian sector, they are very overwhelmed by the cases and the work, etc. And sometimes they might not know what's new within the humanitarian sector, or sometimes the jargon or the regulations might change around refugees. And we realized some public institutions, they deal with refugees, but they might not know how legal aspects of refugees living in Turkey. So we realized during these meetings the needs, and also some of them they share these needs, that some of the groups like bar associations or psychologists, they came to us and say, look, we want to know more. So therefore we developed training curriculum for key refugee groups, access to justice mechanisms, targeting bar associations, because it's very important when we refer beneficiaries to access legal assistance, we refer them to bar associations. So if these lawyers do not know how to approach key refugee groups, they might not provide the accurate services. So we tried working with them, providing comprehensive trainings. We did the same for psychologists and psychiatrists, to just add up some more information about key refugee groups. What is the terminology, correct terminology? What is the way to approach? And we worked on the real life, real cases, so that they can have an understanding. And then we keep following up, referring cases and then receiving feedbacks. So this is very important. And another thing is, important thing is empowerment. In our programs, empowerment is not kind of a part of it, but working with key refugee groups themselves, like our outreach workers are, most of them are coming from the key refugee groups itself, and working with key refugee groups for key refugee groups really enables them, like empowers refugee groups themselves to build up their resilience. It's very important. And then it's not just services. We try to keep our services a safe space, so that refugees they can keep coming in and receive services and then socialize with each other. We started organizing activities called Share and Care. So with our outreach workers, group of refugees, certain key refugee groups, it could be, let's say, trans women or gay men, they can come up together with a semi-structured group. They talk about their positive coping mechanisms. It's not just the service they talk about like where to go, safe places in the neighborhood, how they can help out each other. So these are the activities that kind of helps empowering them then, so they can provide a good guidance on us, how we can improve services and then tackle those stigma and discrimination. We also continue providing this type of trainings to different groups. Training is, I know most of the people are sick and tired of trainings, but there are some issues that that we need to keep organizing trainings for. And this is one of the things we are doing. We are talking with our UN colleagues in UN or NGO sector or public about the correct terminology, because it's very interlinked. People who discriminate against refugees, they also discriminate against gender identity and sexual orientation and sex work and people living in HIV. So when you deal with a group that actually includes all, you need to have a comprehensive approach and do whatever you can from every angle. So yeah, in a nutshell, this is what I can start. I know there are zillions things to be done, but this is some of the actions that we have been following up.
Thank you for the very insightful recommendations. We have a few more questions coming in, so I'm going to try to get through as many as possible within the time that we have left. So there's one for Esty and then another one for Dilara. So Esty, let me ask you this first. So do you face any difficulties in developing or implementing policies or programs targeting, combating GBV for non-Syrian forced migrants?
Of course we do. As IMM and as the municipalities, the role of municipalities in migration governance is not clearly defined by the legal framework, by the regulations in Turkey. It is getting better. There are more roles and responsibilities given by the harmonization strategy and social cohesion action plan published by DGMM. Yet the municipalities have a limitation of budget because the budget allocated to municipalities in Turkey is according to the number of citizens living in the city. This doesn't include migrants and refugees, and there are no clearly defined roles and intervention areas for the municipalities in terms of working with migrants and refugees. Yet many municipalities in Istanbul, including IMM, willing to do more and more in this field. And the main challenge, I guess, we are dealing with working with non-Syrian refugees and migrants is lack of data. Segregated data and lack of registration. We are working with registered and unregistered, of course, with a human rights perspective, but there is a registration problem, of course, we are dealing with. And also we are improving our capacity, but we need to improve more. As I said, because of the mentioned limitations, we need more capacity and more defined framework for the local governments in Turkey.
Thanks, Esty. My next question is for Dilara. Are you aware of any programs that build solidarity between refugee and host women? And aside from working towards social cohesion, how might these networks help combat GBV?
Yeah, thank you for these questions. And yes, some programs are known, for example, women cooperations. I can say that, and social cohesion can be very helpful for common issues like gender-based violence, especially for women. Gender-based violence is a global problem, unfortunately, and in these programs, for example, women cooperations, people can recognize common challenges, common obstacles, and the common issues. And I think for common problems, it is very easier to finding a solution together and create a solidarity between the refugees and the host community. For instance, when people from host community hear a survivor of gender-based violence, they can, I think, have a tendency to find the solution in comparison with other problems. And yes, social cohesion and the other kind of programs can be very helpful to combat gender-based violence.
There's also a flip side to this question, Dilara. I don't know if you want to address that, but there's also a question on whether GBV programming could enhance integration between refugees and host communities, since this is a problem that affects both communities and is not specific only to the refugee community. So does social cohesion, is that kind of included in GBV programming? Are you aware of that? In any existing GBV response programs that seek to enhance social cohesion or social harmonization between refugee women and women from the host communities?
Yeah, there are some programs with the included of combating gender-based violence and the including social cohesion. But the programs and the services regarding the gender-based violence can enhance the social cohesion, because as I mentioned before, unfortunately this issue is a global and it does not discriminates the refugee or the host community, and I think this is the main topic.
Thank you. Fatma, the next one is for you. How does UNFPA, how can UNFPA further develop advocacy programs that focus on intersectionality of vulnerabilities and violence?
We as UNFPA Turkey have been active in Turkey since 2000 which year I must say, 1971. And so we have been working with most vulnerable and marginalized communities ever since. And until the humanitarian crisis happened in Turkey, we have already been working with the groups I mentioned, and also supporting civil society organizations, universities, and governmental institutions, just to assist Turkey's building the country's development capacity. Since the humanitarian program, we have been able to implement this key refugee groups project, which was evaluated to be one of the best practices. As far as we know, it is the only currently the comprehensive program in the world, not just in Turkey, targeting the group and providing services. For us, the biggest advantage on this is that while providing service is a countries like Turkey, the people would like to see kind of like tangible examples of the human stories, how you manage to ensure this person access services, what are through the interventions that you implement, how you manage to ensure this person's improvements in rights and access to services. So showing these kind of real success stories helps, and this is a kind of a way of an advocacy program, part of our program. And this Key Refugee Groups project is not an advocacy program per se. However, we have also to support service provision, we organize such advocacy activities, and part of these advocacy activities is bringing together various public and other civil society organizations together, and also developing manuals, guidelines that will stay forever even after we complete our mission here in Turkey. So those manuals are for trainings, capacity building, so that even when we are gone, the remaining actors could also continue implementing them. And so these are the advocacy steps we are following while working with marginalized group and organizing advocacy activities for the group in countries like ours needs, of course, time and building synergy with various groups. And this doesn't happen in one day, and this is something we are working on every day. However, while implementing such program and showing that it actually works, and showing that a safe space or providing services to the group and involving the group into service provision really works, is one of the advocacy activities, and it's kind of a good example for public officials and also other service providers to see. I don't know if this was the answer of the question, but yeah, this is how we are trying to do it in Turkey.
No, definitely. And I think that, it's an ongoing task. This is a problem that is prevalent, not just in Turkey, but all over the world, and especially with more and more, protracted conflicts and, humanitarian crises, where women and other marginalized communities are disproportionately impacted. And that's why actually we decided to work on this report, because we believe that in order to be able to start solving a problem, it's important to first develop a deep understanding of what the problem is and what are the contributing factors to that problem. So I think GBV is something, as we mentioned before, it's an issue that affects not just the refugee community in Turkey, but the host community as well. And building networks, building relationships, building solidarity, not just between the survivors and beneficiaries, but also between responders and organizations, civil society organizations, pulling together their resources to better serve these communities becomes just as important. So with that, I think we had a few more questions, but unfortunately we're reaching the end of our allotted time, and I want to respect the time of our speakers as well as our audience. So I promise you, if you have more questions, please write to us at admin@hasna.org, and we will try our best to get back to you. But for now, I'm going to have to conclude this session, and I just wanted to take just 1 minute to thank the speakers once more for your time and for logging in late in the afternoon Turkey time to participate in this webinar for us. And for the audience, please go to our website and download our report and read it and share it. And if anything stands out for you, please write to us, and we'd be happy to get your feedback on that so that we can add to our resources on this topic. So thank you once again, and I want to give a special thanks to the Metumir projects team for the invaluable support that they've given us throughout the research and writing phase of the phases of the report. Thank you once again, everybody, and have a great rest of your day. Thanks.
Thank you.